Today, unfortunately, we reported an additional 34 Hoosiers who died of COVID-19 that was reported to us in the last 24 hours. These individuals ranged in age from 37 to 97, and the majority of them died between April the 4th and April the 6th. As the governor noted, we now have had 173 Hoosiers lose their lives to this novel coronavirus. To put this in perspective, on average, over the last 5 years, we've only lost about 150 to 160 Hoosiers in a 7-month period of time to influenza each year. These numbers change daily, and I want to brace you to see them increase as we get closer to the peak of this disease. I also want to reiterate how we announce the deaths. The numbers we release each morning is based on the results reported to our database as of 11:59 the previous day in the evening. Sometimes we're notified by phone of deaths before they arrive in our database, which you saw yesterday when we reported on the Madison County Long-Term Care Facility. Our goal is to provide you with the most current information that we have during our morning dashboard updates and again at these briefings. As the situation changes quickly, that will mean that sometimes our dashboard is still catching up. Our long-term care facilities continue to be a big concern. In addition to the 11 residents of Bethany Point in Madison County who have died, we are aware of another facility in Madison County with 4 deaths which appear to be COVID-related. There have also been 4 deaths in a long-term care facility, as I mentioned yesterday, in Johnson County, and 3 at the facility in Lawrence County. If a long-term care facility has a known or suspected COVID-related death, those should be reported to the local health department and to the Indiana State Department of Health within 24 hours of that death. In addition to residents, facilities should also be reporting on any employees who test positive. Our strike team is going out every day and testing more individuals in these facilities, and we expect to be able to share more data related to these efforts later this week. Today we sent 50 additional testing kits to Bethany Point to test more individuals. I also want to update you on our efforts to expand testing in the northern and southern regions of our state. As part of that work, we'll be launching a targeted drive-through testing operation tomorrow at Maryville High School in Lake County in collaboration with the Lake County Health Department. This clinic will be reserved for healthcare workers, long-term care workers, first responders, and essential workers who are symptomatic of COVID-19. We will be sharing times and other details later today. We're finalizing plans to also set up targeted drive-through testing in Clark and Vanderburgh counties later this week. Please ensure that you are a healthcare worker, a long-term care worker, emergency medical system, or one of these essential people, and that you actually are symptomatic to come to one of these clinics. Although we know that there is asymptomatic spread of this virus, we still don't have the ability to test everyone without symptoms due to our limited resources. From a medical standpoint, someone could test negative today, go out, touch a door handle with COVID-19 and be positive within the next 24, 48 to 72 hours, which is why it's critically important that you continue to stay home. Thank you.
Thank you, Dr. Box.